So my name is Maui Kwamen. I'm a pediatric hematologist at Phoenix Children's, and I've been in this hospital for 4 years. So it's an inherited blood disorder. I like to describe it as a multi-system disorder, meaning that it affects every part of you from your head to your toe. It's genetic, meaning that patients who have it inherit both genes from both parents, so father and mother. And what happens is it affects your red cells. So instead of being nice and sort of round like a donut, they become sickle shaped, which is like the moon, that sickle shaped if you Google it. These cells break easily. They don't live long. So a sickled red cell will live maybe 21 days.
I didn't think it was that bad until I was much older, so I didn't have much feelings towards it. But yeah, didn't really think about it that much. Just went with the flow, if you know what I mean.
So for decades, early medicine we have was something called hydroxyurea that improves the health of the red cells. And it improves a certain type of hemoglobin called hemoglobin F. So by increasing hemoglobin F levels, it makes the red cells healthier, they live longer, they break less easily, and clinically patients have less pain, less episodes of pneumonia or acute chest, and live longer. I would say in the last decade, we've had several new drugs, 2 new drugs or 3. There's something also called crizolizumab or Adakveo. That's for patients 16 and older, and it helps to reduce the stickiness of blood cells to vessel walls, which is one of the things that causes pain because the red cells stick to vessel walls and cause that jam. And crizolizumab reduces that and reduces pain. There's also L-glutamine, which is an amino acid, and it's been shown to decrease pain. And then a medicine called voxelotor. And the way that medicine acts is it causes the red cells to bind tightly to oxygen. And so what happens in sickling, and so as blood circulates, your red cells get to your lungs, they pick up oxygen when you breathe, and then they redistribute the oxygen as they circulate around the body. So sickling happens in the body when the red cells release the oxygen or they're deoxygenated. And so voxelotor makes the red cells bind more tightly to oxygen, so they release it less. But it doesn't mean they don't distribute oxygen to the rest of your body. They still do, but don't give it up as readily. And that helps reduce sickling. It helps to reduce the cells breaking down, and overall improves hemoglobin levels. So it's another drug. So these medicines that I've talked about, or these drugs, don't cure sickle cell, but they improve patient outcomes. They improve the way patients feel, and hydroxyurea in particular, we know improves overall lifespan. But sickle cell has a cure, and that's bone marrow transplant. So that can be done with a sibling who is a match for you. And then you may have heard more recently in the news of gene therapy, which we are calling a transformational therapy. We're not calling it a cure yet, but it's making a big difference in the lives of our patients, and that does not require any donor, but it's your own stem cells that are genetically modified and given.
Not so much. I mean, I had to get daily, monthly infusions, which in Uganda they didn't really do matching of blood with blood. So that was, I guess, the biggest one. I got a lot of iron and antibodies that weren't supposed to be in my blood, but I got them anyways. So that was the main one that caused a lot of issues. Yeah, I actually got a treatment, a bone marrow transplant, which from now I only have trait because I got my marrow from my sister, and she only had Trey. I don't have sickle cell anymore, but yeah. And my parents were always supportive. So yeah, I did.
That's good.
There's a variety of different counseling. Obviously, when it's a new diagnosis for a family, it's always a big shock. So we tell them the medical aspects of it, but we also have social workers and psychologists on our team and try to make sure that we are given comprehensive care, looking at the family as a whole. So yes, we do the medical aspects of it. We do genetic counseling, but we also try to include psychosocial aspects of care into our patients that we see. I tell patients, don't let sickle cell determine how you live your life. I mean, it's a life-altering disorder. There's no doubt about it, but you live to achieve your goals. Yes, there are certain conditions that make you as a sickle cell patient more likely to get crisis or pain. So extremes of heat, extremes stress, infections. Patients who have sickle cell disease because of anemia may not have as much endurance in terms of sports as patients who don't, but it doesn't mean they can't play sports. It's also very important that you stay hydrated, well hydrated all the time, because dehydration is one of the things that leads to crisis. And it's important that, you get your routine care. You see the doctor even when you're well. Parents are very protective when you have a child with a chronic disorder like sickle cell. I also very much want kids to experience everything else that another child is experiencing, but being cautious about things like whether, a PE teacher shouldn't make a sickle cell patient run 5 miles on a 115-degree day. Parents would request that on very hot days, their child with sickle cell doesn't get recess outside, and I think that that's reasonable. Children with sickle cell at school may sometimes need to have elevator access. If they have chronic hip pain, they can go up the stairs. We tell our kids to have huge water bottles and drink all the time. We want our schools to give our children unlimited bathroom breaks, so they can go to the bathroom anytime. It's simple things like that that we talk about. And then, of course, children with sickle cell, because they're immune compromised, we always ask them to call us when they have a fever and not to just sit at home and take Tylenol or ibuprofen.
I couldn't be in the cold because every time I was in the cold, I would I would get a pain, which is called the sickle cell crisis. But yeah, I couldn't be in the cold, had to live in a warmer area and couldn't play outside because whenever it was cold, most times my mom didn't have money for me to go to school, so I couldn't go to school. A lot of family stuff I couldn't do because I was really unwell, and half of the times I couldn't go to school and stuff.
I'd say that there's a lot of hope in the future, given what we know. We've come a long way. We know more about sickle cell disease now than we ever did. And we are certainly, in terms of long-term survival, we are doing much better in the US. That's not to say definitely all around the world. And there are curative options like bone marrow transplants and disease-modifying therapies, which may not cure the disease, but which do make a big difference in the lives of patients. I like to tell patients that there's nothing about you most of the time that tells patients you have sickle cell. And so sometimes there's nothing written in your face, there's nothing that's screaming. So it's sometimes hard for patients to think about getting on a daily medicine, if you have sickle cell and you're not having problems. But it's a pretty life-altering disease that's causing organ damage. So I do encourage patients to think about the disease-modifying therapies we have, even when they feel well. and to just check in for when they feel well. We have them come in every 3 months or so, and not just come in when they're sick. And for patients who have young children or parents who have young children, just sort of emphasizing that lifespan and care is changing, and there's hope that patients will have long, full lives, and we're working on it, and that cure is an option now.
Trust the process, trust that there is treatment for it, and honestly, whatever the doctors tell you to not do, probably should not go do that kind of stuff. Trust the doctors that they're there to help you, and everything will be okay in the end. My mom, she was always there, and I feel like I had some pretty good friends. Family helped me a lot, and also just like the thought of having another day, even if it was in pain, just living another day was pretty much my goal.